So proving that a stop clock tells the right time twice a day, the government has made a sensible decision, and it is in making people who are self-isolating because of the coronavirus COVID-19, they're going to be eligible for sick pay from day 1 rather than day 4.
If we ask people to self-isolate, they may lose out financially. So I can today announce that the Health Secretary will bring forward, as part of our emergency coronavirus legislation, measures to allow the payment of statutory sick pay from the very first day you were sick instead of 4 days under the current rules.
But that doesn't change the fact that this disease is really serving to expose the gaps in workers' rights and some of the problems in the British labour market which Conservative governments have consistently failed to address. Take sick pay. For those of us in full-time jobs with good employers that have sick pay schemes, well, we're okay. If we need to self-isolate, we can do that. Where working from home is an option, good employers are making it available. But not everyone's in that happy position. Let's say you're among the millions of people who aren't blessed with a good employer. While you can get statutory sick pay from day 1, it's still only worth 94 quid a week. It's less than the minimum wage. From the change that the government announced, you'll get an extra 80 quid. But bad employers don't tend to pay well, and therefore people who are having to rely on statutory sick pay rather than a sick pay scheme are still going to face a nasty financial dilemma. Either you self-isolate and suffer a nasty hit financially to your pocket, if you've got loans to pay, if you've got kids to feed, or you turn up and you cross your fingers and you hope that you've not got infected. And this matters because, well, let's look at the NHS at this point. Trusts really don't want clinical staff who might be sick turning up and infecting patients and colleagues. So doctors and nurses who need to self-isolate, they'll be told to go home if that's necessary and they'll be covered, they'll be okay. But it isn't just clinical staff that have contact with patients. Caterers, drivers, porters, they're all often employed by contractors. And contractors' terms and conditions are usually appreciably worse than those offered by the NHS. You can see where I'm going with this. Efforts to combat the spread of this virus could also be affected by the injustices of the gig economy. People like Uber drivers don't have any employment rights and they don't have any employment benefits because they're not considered as employees. That means they don't even qualify for the pretty miserable statutory sick pay payments I mentioned. If they don't work, they don't get paid. So what do you think they're going to do if they're on low incomes, as lots of these people are? If they've potentially been exposed? They're probably going to turn up for work, and I wouldn't blame them. Dave Prentice from Unison has written to the DWP calling for the government to do more, and I think it should listen. The coronavirus might not turn into the problem that's being suggested by some of the worst case scenarios we've been seeing. There is a hint of the panic in the air, and that's not healthy. But the efforts to stop its spread, which are sensible, are currently crashing into the disease of the gig economy. Britain's bad employers and its pretty poor record on workers' rights, and it really is time that that was addressed and changed.